Hi! We live in an era where the art of teaching is radically changing. We no longer belong to the generation where resources were lacking, instead tons of information is readily available. Anatomy is a topic far beyond the acknowledged textbooks. Someone who seeks to deeply understand what is really going on has to dive into the microscopic scale. That is especially true for the head and the neck, where millimeters matter. The information is out there, yet it is so specialized that emphasizing on a specific structure ends up ignoring nearby anatomy millimeters apart within the same organ. For instance, if you try to conceptualize the anatomy of the protympanum, the mental devotion at the moment probably won't let you think about the tensor fold, the rest of the middle ear folds, or even the general aeration pathways of the middle ear and vice versa. I faced the same problem, so I started making 3D models. I tried to keep a high level of anatomic detail combining diverse resources into a single model. This way someone can visualize these complex anatomic notions as a whole. Each time a new notion is introduced, you can construct a perceptual 3D image in your mind step by step. This is a demanding task, but I assure you that by the end of this video series, this perceptual image will be as close to reality as possible without gray areas. The first video series will be about the descriptive anatomy of the middle ear folds, the most neglected content of the middle ear. So let's start! The first distinction that we have to make in order to give context to our descriptions is that between duplicate and composite folds. Till the 20th gestational week, middle ear contents are still surrounded by mesenchyme. In this 19 cm embryo, the fund of each tubotympanic recess starts budding into 4 thin-walled mucosal pouches. These pouches grow, giving rise to every air-filled compartment of the middle ear in the future. Every time the wall of a growing bubble meets another bubble, a mucosal sandwich is formed. 2 layers of mucosa divided by a layer of mesenchyme. The tensor fold is this kind of a fold, created by the meeting of saccus anticus and saccus medius. These are called duplicate folds. On the other hand, when a growing bubble meets a fixed structure, splits in 2 parts, enclosing that structure in the middle layer. The lateral mallear fold contains connective tissue bundles of the lateral mallear ligament. This is a simplified embryologic reference. We will talk about the elegant cavitation process of the middle ear in a future video, after having established the anatomic foundations. So, which are the fixed structures of the middle ear cavity that lead the reflections of mucosal folds? The first anatomic structure that we are going to encounter is the tympanic ring, or Gerlach's ligament. This structure has not a true ring conformation. Instead, we can imagine it as a curved line with a bifurcation at both ends. This curve lies in the tympanic sulcus, around only the pars tensa of the tympanic membrane. The ligament bifurcates at the level of the tympanic spines, anteriorly and posteriorly. The anterior division gives rise to the anterior tympanomallear fold, which is sticking to the inner surface of the tympanic membrane, dividing the pars tensa from the pars flaccida anteriorly. The second division reflects medially and attaches to the level between the head and the neck of the malleus, forming the anterior suspensory ligament of the malleus. This is more of a fan-like spread, giving connective tissue support to the anterior mallear ligamental fold. Likewise, the lateral trunk of the posterior division gives rise to the posterior tympanomallear fold, again attaching to the tympanic membrane and dividing the pars tensa from the pars flaccida posteriorly. Both the anterior and posterior tympanomallear folds attach to the lateral process of the malleus. The medial trunk of the posterior division forms the posterior mallear ligament. This structure is inserted to the neck of the malleus. Next, we will describe the rest of the malleus attaching structures. The anterior mallear ligament begins from the anterior mallear process of Ravius, passes through the petrotympanic fissure of Glasser, and eventually inserts to the sphenomandibular ligament connecting the malleus with the mandible. This peculiarity has deep embryologic and evolutionary explanations. The superior suspensory ligament of the malleus extends from the tegment to the head of the malleus, giving connective tissue support to the superior mallear fold. The lateral mallear ligament hangs in the middle layer of the lateral mallear fold, giving structural support to the anteriormost strong portion of this fold. Medially, it is attached to the neck of the malleus and laterally to the scutal rim. Now, try to imagine malleus with its 5 + 2 ligaments in space. We described the anterior, lateral, superior suspensory, anterior, posterior mallear, and finally the 2 tympanomallear ligaments. In addition to those, we have also the tensor tendon, extending from the cochleariform process of the medial wall to the neck of the malleus laterally. Check the spatial relationship of the cochleariform process at the medial wall and its resemblance to cochlearion, the Greek word for curette. Incus has its own 2 ligaments. These are the superior inguinal ligament hanging the inguinal body from the tegment and the posterior inguinal ligament attaching the short process to the inguinal buttress, the bony ridge between the lateral semicircular canal and the tympanic bone. The strongest ligament of the inguinal-mallear complex are the anterior mallear ligament and the posterior inguinal ligament. Between them lies the axis of ossicular rotation. The remaining ligaments just stabilize the rotational motion around that axis, following the movement of ossicles by elastic deformation. Stapes is attached to the oval window by the annular ligament, an elliptic bundle of connective tissue around the footplate. The annular ligament is thicker posteriorly and weaker anteriorly, imposing stapes to follow a hinge-like motion. The tendon of the stapedial muscle emerges from the pyramidal eminence, floats over the posterior sinus, and eventually inserts to the posterior rim of the stapedial head. Chordae tympani is the last structure affecting the conformation of mucosal folds in its course through the middle ear. This nerve originates from the chordal eminence, through a canal called iter chordae posticus. Then, crosses the mallear neck, progresses anteriorly, parallel to the anterior process of the malleus, and exits the middle ear through the canal of Hugurier, the medialmost part of the petrotympanic fissure. That's all for part 1. In the next video, we will use the structures we have just described as a backbone in order to precisely describe the main conformation of mucosal folds. Don't lose your courage. This is a difficult topic to get. Now, take some time and try to build the same model in your mind. When you manage to build that mental 3D image, everything will look much simpler. Bye, see you in the next part.